Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Our lecture today will be about cell injury, cell death, and adaptation. Part 2. Lecture objective. We will talk about the types or patterns of necrosis, which are 6 patterns: coagulative, liquefactive, caseous, fat, fibrinoid, and gangrene. And then we will talk about intracellular accumulation, which may include exogenous pigmentation or endogenous pigmentation. And at the end of our lecture, we will talk about pathological calcification. So, the first type of necrosis, we call it coagulative necrosis, which is the most common type of necrosis, occurs anywhere in the body except the CNS, usually due to hypoxia. Grossly, there will be whitish, grayish, or red hemorrhagic, firm, wedge-shaped area of infraction, the occluded vessel at the apex, and the periphery of the organ forming the base. Histology, there will be preservation of the tissue architecture and cellular outline, with loss of the internal details including the nuclei. It results from denaturation of proteins. So you can see at the left side there is kidney, and in the kidney there is wedge-shaped area of infraction which appears whitish in color, and at the right side of this kidney we can see the histology of the kidney, and in the left side we can see that the renal tissue is viable, while on the right side there is coagulative necrosis where there is loss of the details of the tissue but preservation of the outline of the renal tubules. At the right side you can see there is spleen with wedge-shaped area of infraction or coagulative necrosis. So infraction, it is an ischemic necrosis which is caused by occlusion of either the arterial supply or the venous drainage. Coagulative necrosis is characteristic of infrax in all of the solid organs except the brain. Okay? So the second type of necrosis, we call it liquefactive necrosis, which is seen in ischemic necrosis or infraction of the CNS, and also seen in focal bacterial, occasionally fungal infection, or abscess formation in pyogenic infections in all tissues. In liquefactive necrosis also there will be the enzymatic digestion and autolysis with protein denaturation, so the area will become soft and cystic. Grossly, there is softening and liquefaction of the necrotic tissue, so it will appear like soft liquid-like area. Macroscopically, there is complete loss of tissue architecture with loss of original tissue, and the area will contain necrotic debris and macrophages. This slide represents the lung tissue, and we can see an area of abscess in the lung, and this area is called liquefactive necrosis and cavitation. In this slide you can see this is the brain tissue. These are the normal areas, and here we have an area of liquefactive necrosis, and in the slide you can see the area of liquefactive necrosis. There is loss of the tissue architecture and loss of the details, and it appears like homogeneous area, pinkish in color, and surrounded by inflammatory cells, mainly macrophages. Third type of necrosis, we call it caseous necrosis. It is a special form of necrosis usually seen in tuberculosis. Grossly, it is soft and yellow, white, and appears as cheese-like material. Microscopically, the tissue architecture is completely lost, and the necrotic area appears as amorphous, structureless, granular, eosinophilic material enclosed within an inflammatory border. It could be seen in other lesions, so it is not pathognomonic of tuberculosis. In this slide, you can see this is the lung, and you can see at the center we have this lymph node that appears yellowish, whitish, and cheesy-like in appearance. In this slide, you can see there is here the area of caseous necrosis, homogeneous, structureless, eosinophilic material surrounded by inflammation. The other type of necrosis, we call it fat necrosis, which is mainly of two types, either enzymatic fat necrosis or traumatic fat necrosis. Enzymatic fat necrosis usually follow acute pancreatitis due to release of pancreatic enzyme lipases, and this will result in necrosis of pancreatic tissue and release of a free fatty acid, which combined with calcium to produce a grossly visible chalky white area, and this is called fat saponification. So, due to the action of lipase enzyme that is released from the pancreas, this will result in necrosis of the pancreatic tissue, and this necrosis will result in necrosis of the fat surrounding the pancreas, and this will result in addition to combination with calcium, a process like a fat saponification. The other type of necrosis, we call it traumatic fat necrosis. It occurs in the breast after a trauma, which is caused release of fatty acid from the cells. This will stimulate macrophage infiltration, which will engulf the fat, and the inflammation will result in massive fibrosis, so the lesion grossly become hard, mimicking carcinoma. This is the fat surrounding the pancreas, and you can see these small whitish nodules or deposits represent area of fat necrosis in addition to calcium formation, and this we call it fat saponification. Here we have healthy fat cells, and here we have areas of fat necrosis. Okay, and in the slide you can see these the healthy fat cells, and here we can see these are the necrotic fat cells with calcium deposit, so it is called fat necrosis or fat saponification. The other type of necrosis, we call it fibrinoid necrosis. It is characterized by deposition of fibrin-like material in the tissue. For example, fibrinoid necrosis of the blood vessels in malignant hypertension and in vasculitis. Macroscopically, there will be bright eosinophilic material seen in the wall of a blood vessel or in the luminal surface of the peptic ulcer. In this slide, you can see this is a blood vessel. This is the lumen of the blood vessel. This is the tunica intima, and then tunica media and tunica adventitia. You can see in the tunica media we have this eosinophilic, structureless, homogeneous material that represent an area of fibrinoid necrosis, and here the fibrinoid necrosis occurs due to immune complex deposition in the wall of the blood vessel. The last type of necrosis, we call it gangrene or gangrenous necrosis, which is not a specific pattern of cell death, but the term is commonly used in clinical practice. It is usually applied to a limb, generally the lower limb, that has lost its blood supply and has undergone necrosis, typically coagulative necrosis involving multiple tissue planes. Gangrene may be classified either as dry gangrene or wet gangrene. This picture represents gangrenous necrosis. At the left side, you can see here there is dry gangrene due to ischemia of the finger, and here we can see there is wet gangrene that occurs when there is loss of blood supply in addition to superadded bacterial infection, and the wet gangrene is commonly seen in diabetic patient, and in this condition we call it diabetic foot. While dry gangrene, there is only ischemia without superadded bacterial infection, and it can be seen, for example, in cases where there is exposure to cold temperature, for example, In frostbite, you can see areas of ischemic necrosis like this picture, and we call it dry gangrene. Now, the other subject in our lecture is about intracellular accumulation. Under certain circumstances, cells may accumulate abnormal amounts of various substances, which may be harmless or associated with variable degree of injury. The substance may be located in the cytoplasm, within the organelles, typically in the lysosomes, or in the nucleus. Pigmentation. Pigmentation represents a type of intracellular accumulation, and the pigmentation mainly of two types, either exogenous pigmentation, and the exogenous pigmentation include carbon or coal dust, in which there is accumulation of carbon particles in the lung that will give rise to the black color of the lung, and in this condition we call it anthracosis. If there is excess deposition of carbon in the lung, it may cause extensive fibrosis, and the condition is called pneumoconiosis. The other type of pigmentation or other type of exogenous pigmentation is tattooing, which is the pigment included in is taken by dermal macrophages, which is harmless. And tattooing is common nowadays, especially in young people, and it is done for cosmetic reasons, in which there is pigment inoculation that will be taken by dermal macrophages. This slide represents carbon particles in the lung and the lymph node. In the left side, you can see this is a gross picture of the lung with lines of blackish dots that represent carbon particles. On the right side, there is a lymph node, and in the lymph node, you can see there is accumulation of blackish material due to carbon particle deposition. Now, endogenous pigmentation, and the endogenous pigmentation we mean by which the material that is produced from inside our body, and it is not came from outside of the body. So the exogenous pigmentation, and the first type, there is pigments that came out from outside the body, okay, like carbon or like tattooing. But in endogenous pigmentation, there is pigments that are produced from inside of our body. First type of these pigments is the lipofuscin, which is a yellowish brownish pigment seen inside the cells of the liver, heart, brain, and it is seen mainly in old age people. We call it wear and tear pigment. It is a marker of damage by free radicals, and it is seen in patients with severe malnutrition and cancer cachexia. This is a slide of the liver tissue, and you can see inside the liver tissue we have brownish yellowish pigment, and this pigment we call it lipofuscin pigment. Okay. Melanin is an endogenous non-hemoglobin derived brown blackish pigment. The skin pigment is produced from tyrosine by the action of tyrosinase enzyme within the melanocytes. Lesions associated with melanocytes are either benign lesion, we call it moles or nevi, or malignant lesion, we call it melanoma. And this is an example of benign nevus اللي احنا نسميها الشامة. زين. This is a type of melanin which is black in color, and it could be benign in the moles, or sometimes it could be malignant, and if it is malignant we call it melanoma. The third type of pigments, we call it bilirubin. Bilirubin is yellow brownish pigment. It is derived from the heme portion of hemoglobin. The conversion to bile occurs in the liver. Excess accumulation of bilirubin pigment will lead to a clinical condition, we call it jaundice. Jaundice characterized by yellowish discoloration of the skin and mucous membrane. So you can see here there is yellowish discoloration of the sclera of the eye, and which is seen commonly in patients who have jaundice, which is jaundice, we mean elevation of the level of bilirubin pigment inside the body. Another type of pigments, we call it hemosiderin, which is a hemoglobin-derived golden yellow to brown granules, and the hemosiderin represent excessive iron in the body that will cause the hemosiderin to accumulate within the cells, and there is a special stain for the iron. We call it prussian blue or pearl stain. Excess deposition is termed as hemosiderosis, and the hemosiderosis, it could be either due to localized or systemic causes. Here you can see there is hemosiderin pigments in the alveolar macrophages, which is brownish in color, accumulating inside the macrophages, so we call it hemosiderin-laden macrophages. And by the use of a Pearl stain or Prussian blue stain, you can see that the iron appears as bluish dots, and these bluish dots represent iron material accumulated inside the lung tissue. Now, the last subject in our lecture today is about calcification or pathological calcification. So, what we mean by pathological calcification? Pathological calcification is the abnormal deposition of calcium salts together with smaller amounts of iron, magnesium, and other mineral salts inside the tissues, and it is mainly of two types. The first type is called dystrophic calcification, in which there is deposition of calcium in non-viable or in dying tissues in the presence of normal serum level of calcium with normal calcium metabolism. So in dystrophic calcification, the serum calcium level is normal, the calcium metabolism is normal, but the tissue is dyed or necrotic, and in this type of calcification it is called dystrophic calcification. For example, in areas of necrosis, in the wall of the artery in atherosclerosis, in the diseases of the valve, in aging or damaged valve, in dead parasites and their ova. Here, the slide represents aortic valve stenosis, and in this aortic valve, you can see here areas represent calcium deposits inside the valve, and this type of calcification we call dystrophic calcification. Here, the wall of the stomach, you can see in the wall of the stomach there is a dystrophic calcification in the wall of the blood vessels inside the stomach. Okay, so the arrow here represent an area of dystrophic calcification in addition to these areas, which appears like amorphous purplish color. The other type of necrosis, we call it metastatic calcification, in which there is deposition of calcium salts in normal tissues, and it is almost always resulting from hypercalcemia secondary to some disturbance in calcium metabolism. Organs affected are the kidneys, stomach, lungs, pulmonary veins, and systemic arteries. So, metastatic calcification represents a type of calcification in which there is normal tissue, but the level of calcium in the blood is high. We call it hypercalcemia, and this hypercalcemia will result in calcification of normal tissue. You can see in this slide, this is the lung, and in the lung, in the alveolar septa, you can see we have areas of calcification, and this areas of calcification we call it metastatic calcification. This is the reference of my lecture, and thank you for your listening.